Yes, Viva.
Yes. Okay. All right. Thank you. Just before I start, I would like to really thank the organizer, the team that's been putting together this webinar now that we're coming to the third series. And for me, is even though the time issue is, or the time difference is an issue, but I'm sure as a young Pacific woman, like as usual, as families, we always come up with solution. We'll come up with something in the future, how to balance up the time. But the fact that families still trying to organize, still creating spaces to share alternatives, to share strategies at this kind of period of time when we are going through we are going through pandemic and we are going through a lot of restriction from our own different countries. I think that's a heads off to all feminists, all women's groups, and especially to the marvelous organizer of this dialogue at this webinar. For me, morning for me, I'll be talking about alternatives that the work that we are doing on the ground with my home organization, which is Diverse Voices in Action for Equality, or Viva for Equality Fiji. There is so much that we can actually know that we can share strategies on the work on the ground. So I will just try and focus on 3 strategies just to make sure that I capture the time. And like Veronica, if there's anything afterwards that I would love to reach out and love to also dialogue with others who are interested to know more about the work. But from the work that we've been doing within DIVA, DIVA works under 5 main work streams. And during this pandemic period, we've really been trying to specify where do we focus our work and our resources on. So for the past 6 months, we've been really taking on the work around the human rights for all, which is our workstream 1. This workstream acknowledged that there can be no justice without bodily autonomy, human rights, and justice for all. And for us, that includes like rights to water, rights to access education. In Fiji, due to COVID, we had a 15,000 job loss, and that leads to having 35,000 children not being able to attend schools when school restarted in July. There was difficulties from homes because of job losses and other difficulties that women having to struggle with preparing meals. So one of the programs that DIVA is taking on right now as part of our urgent response, which is under our workstream 4, is trying to provide love meals for schools. At the moment, we are catering for 300 plus students and providing 800 meals. 8,000 will be providing 8,000 meals for the duration from now until December 18th. So one of the things that is clear for us is it's not just about serving meals for these kids. It's also about employing women that has marginalized and already do not have any source of income, or do not have the context around volunteer in our countries might be different. Because for us, volunteer, if we are already from a marginalized community and we are expected to be doing this feeding of children, that for us is just the same as you extract from people and you don't give back anything. So part of this love meal that we're doing, we're making sure that we are also acknowledging the part that it's also about economic justice. How are we really doing this solidarity economic, not even outside as a whole, but within ourselves in our communities. So part of the work that we're doing with the love meal is not just about serving food, but also how we are trying to help 20 to 30 women have a source of income to help their families and their loved ones to sustain themselves. So for us, that's kind of where our program is at. We're important part of that program. And one of the issue that we're also getting a bit frequent now is not having adequate health services or supplies in rural maritime areas. So for last month and the last 2 months, we've been supplying dispensary kits for villagers in the maritime. Simple kits that has Panadols, that have thermometer thing for kids Panadols. Those little things matters, because when you're in a maritime place and you're having COVID striking around and there's a fever, when there's no supplies in those little dispensary, how would you expect the communities to strive out of it? Or how would you even expect them to be okay to be facing the challenges that COVID is coming with in the health wise? And also part of the work that we're really trying to be very clear now is being clear on our roles and the part that we play in the broader movement. One of the things that is very clear is, and I think this is part of what was also shared by a non-profit organization, which is, I also like to acknowledge the work that they do, is Initiative for Equality. The fact that working with and through existing community instead of reinventing new works. I think for Viva for Equality, we've spent the past 9 years in just trying to build community and constituency. So when pandemic and COVID-19 strike, it was so easy to move around the national level because we've built 9 hubs around the country. We've have sustainable women's networks around around the divisions around Fiji. So those were actually the ears and the tellers of the issues and the updates. They were giving us updates from what they were going through from rural, remote area, from maritime. So part of the work that we're trying to do is not reinventing the wheel, but how do we use existing relationship, existing networks to help us overcome these pandemic issues that we're going through. And I think also the bit that I would like to share about was the increasing number of domestic violence within our homes. Fiji, Diva conducted a research 4 years ago. It's unjust, unequal, and unstoppable research, and I will try and get Marisol to share the link also for that research. Within that research, it states that the violence for LGBTI women is 80+% out of 645 women went through violence. So having this COVID-19 striking and the enforcement of restricting movements and so forth, this kind of escalate this number up again. And also within the job loss, 61.89% of our LGBTI women were already not part of the mainstream employment, but were still doing some precarious work. But having COVID and this close down of all these little car wash and all this stuff that used to employ some of these communities, this kind of also led to them being unemployed and, kind of really putting them at a very complicated place where they have to leave their homes, to give up their homes and to move back into their family homes where they were not even accepted in the beginning, the reasoning of them moving out. This leads to them losing, having to do getting involved in other sort of things that they wish that they don't have to involve themselves with, because they were somewhere stable and they were somewhere where they can really thrive. So for us, as part of the work that we're trying to do that with community, is this thing that feminist funds is very flexible, and at this kind of crisis period, it's the source of resource that we can really depend on. And even though it's a feminist fund, and we are grateful for this kind of funding because it allows flexibility to accommodate certain issues that normal mainstream kind of funding cannot accommodate. For us, the bit that we can provide some unconditional cash transfer for communities when they need to go for medical services, when they need medical supplies, when they need rent payment for at least a month, just to cover them, for them to be able to look for something else to sustain themselves. So this kind of funding is helpful. But that but then again, it takes time to build the trust with funders to make sure that there is a trust in from the grantee to the grantor, and then how to maintain that trust over the years. And I think for the work that we all trying to do as women's network, as feminists, it's all about, if there is no justice, if it's not a change, the work that we're doing, if it's not creating any change, material or structural, then we need to keep revisiting our practices or the way that we are moving within the networks. Jasmine, I'll stop there and then I'll give it back to you.